Well, good morning. How is everybody? A lot of energy in this room, just as we've had for the last, has it been 2 days? It's just, I went home just totally depleted last night. Well, I'm really looking forward to today, because I think this is where the rubber really does sort of hit the road in commitment and action, and so hopefully you're all feeling the same way. I was going to be introducing our secretary, Diana Dooley. She is the secretary of the California Health and Human Services Agency. However, as many of you know, she is also the chair of the California Health Benefit Exchange Board. And later this morning, she's going to be announcing the health insurance plans that are going to be sold through the Covered California Marketplace that go online in the fall. So that's a pretty significant announcement. However, our Undersecretary, Michael Wilkening, was gracious enough to accept our offer to come and share his thoughts and the Secretary's thoughts around interoperability. Mike is our Undersecretary of Program and Fiscal Affairs and was appointed in 2008. From 1995 to 2008, Mike served in a number of leadership positions with the California Department of Finance, including Program Budget Manager for the Health and Human Services Unit. So he is very familiar with these programs and the commitment of the Secretary on service delivery, and certainly, you know, this whole issue that we've been discussing for the last few days about sharing information is a priority. How we do it in a secure and confidential, where it needs to be confidential, but also understanding the need to really be able to serve our constituency in a way that in today's world makes sense, you know, easy. So with that, please join me in welcoming Undersecretary Wilkening.
So as Debbie said, I'm Mike Wilkening, the Undersecretary of the California Health and Human Services Agency, and unfortunately Diana Dooley, all of you can tell I'm not Diana Dooley, was unable to come this morning, and she does send her regrets. We are focused right now on implementing healthcare reform on January 1st. This is an historic moment in California and the nation's history. Many hours are being devoted to moving forward, finding solutions, and preparing to enroll people in coverage. One aspect of that endeavor is bringing up the California Healthcare Eligibility, Enrollment, and Retention System, CalHERS. You can see why some things have acronyms. And Debbie and Shell, along with folks from Social Services, Covered California, Healthcare Services, Mr. MIB, and the counties are partnering to bring that system up. This is an incredible task, bringing up a major data system in an incredibly compressed timeline. This conference is examining a very important and related topic: how people share their information with government, and how government systems can most efficiently share that data to provide services to people. I want to thank Shell and Debbie and OSI for bringing everybody together to talk about this. It's imperative in moving forward in this area that we have these dialogues, that people have a venue for hearing ideas, for talking, and for generating questions. Interoperability holds a lot of promise, but there are many issues that we need to examine and resolve, only one of which, and really kind of, in my mind, one of the least important really, is the technology associated with it. Our current environment holds many challenges for interoperability. Among those, we have program silos, we have siloed technology systems, we have old systems. I was amazed maybe a year ago to find that we still exchange data on microfiche. I didn't even know you could find a microfiche reader anymore, much less that this is a way that we would actually move data around in California. Security. The way that I found out we move microfiche around is that it was lost. And so people's personal information was compromised and out in the public in a way that it wasn't supposed to be. The terminology that we use between the systems, one word doesn't mean the same thing. One data field isn't the same across the different systems. Figuring out how to define things and how to measure and collect is a big challenge. As I said, that we have old systems. They've been patchworked. We're bringing other systems up. So we have some that are coming in replacement, but as in just about everything with this state, there are very little resources. So we have some new systems coming up, but there are other systems that are quite old and probably won't be replaced anytime soon. So figuring out how to bridge the technology bridge between those systems is going to be a challenge. There are many other issues that we need to examine before we're ever able to implement a technological solution here. We need to determine which data to share, the reason for sharing it, how to share it, and how to ensure that people who need it have access, and those that shouldn't have that information, this personal information, don't have access to it. That's incredibly difficult in this environment. It's easy to say that we shouldn't. One group came to me several months ago, and they talked, I think it was about the system in the Netherlands, where by law, now we have nothing like this in California, by law, you can only ask once for a piece of information. So if they're looking for something, they collect it once. And then every system has to somehow share that data field across all the different aspects of their programs. I think that's wonderful. That's a laudable goal. That's very efficient. And then I think of it in the context of California, it scares me to death. Both in figuring out how we would possibly do that, and then the implications of doing that all of that data resides in one place. And definitely wouldn't get it all on microfiche, but it could well be on a tape that's on a truck that the tape wasn't there when it got to the place it was supposed to go to. That's very concerning. Those are the types of things that keep me up at night. Those are the types of things that when I get the phone call from a department saying, we've lost 100,000 data, a data tape that has 100,000 people's personal information on it, and what that means for people, and what that means for the confidence that the people have in their government, and in providing that and entrusting that information to their government to provide services. So I've raised a lot of issues, questions. I'd love to tell you I have the answers. I don't. We recently appointed an executive at the Department of Social Services, Adam Dondro, to assist us in determining the right questions to ask, examine the barriers, help us engage in the discussion around interoperability. This conference and the conference that's coming up that OSI is organizing is also going to be helpful in figuring out what those questions are and how to move towards solutions. I'll leave you by saying that the idea of efficiently using information, sharing it across systems, and providing needed services in the least burdensome manner while ensuring privacy and security, I think is a laudable goal. And I look forward to continuing that discussion both in these types of venues, with the legislature, with the public, and figuring out how to move forward, because we do need to be better at sharing information. We do need to be more efficient. But we also need to keep our eye on, we need to ensure that that people have confidence in sharing that information and know why we're asking for the information that we're asking for, and that we're able to do that in an effective manner. So the topic that you all are examining, I think, is incredibly important, and I look forward to hearing more about what's coming out of this symposium. Thank you.